listening to CBC Radio 192.5 FM in the Cowichan Valley. Access to family doctors is a constant concern in many parts of this province. As you may have heard in the news today, the Northern Health Authority says it's short 48 doctors. And right now, the BC College of Physicians and Surgeons website says there's just one physician accepting new patients in Victoria. Well, today, the BC government and the BC Medical Association announced a plan to find a family doctor for everyone who wants one by 2015. Now, part of the process is connecting patients and physicians by phone. Margaret McDermott is BC's Health Minister. We've reached her this afternoon. Good afternoon, Minister.
Hi, Joanne.
Let's start with the telephone part of this plan. How will that work?
In the past, there's been a very limited ability for family doctors to do work by the phone and to get compensation for it. So in other words, they could talk on the phone all day if they wanted to, but they weren't getting any compensation. What will happen as part of this new access to family doctors is that for certain kinds of conditions, patients will actually be able to contact their family doctor and receive advice and recommendations by phone. This is part of an initiative to free up time for doctors, so to make things more efficient, to make their practices run more efficiently. It's also, in some cases, going to be better for patients because there's sometimes when it's actually quite difficult to go to your doctor. Some people have issues with transportation, getting around may be hard for them, and there's some kinds of medical conditions where you can just get advice over the phone, maybe about changing your medication or do you need to take a trip into the emergency department, those kinds of things, and you can sort it out fairly easily.
Now, in looking at the background here, it says that doctors will be paid $15 for those calls, and they'll have a maximum 500 calls per year.
Mm-hmm.
You've been in practice. Does that seem practical?
You know, the way that this model was developed and the funding in various different areas was the Ministry of Health actually working with family doctors, so people who are out there in the system working. And they looked at various different places. It was thought that this would make a difference. And we've had 3 pilot projects around the province that have been extremely successful. Patients in White Rock, South Surrey right now, there are no patients waiting to find a family doctor. So they've been able to build some serious capacity. And this isn't the only thing. There's other things that they've been doing as well.
But they have tried the ability to phone a physician then in White Rock?
I think they have. And the other part of this is there's the ability for family doctors to telephone conference with people. There are some patients that are really require a lot of planning and coordination, and so they would be working maybe with a team at the hospital when someone was being discharged, or maybe with a home care nurse, or maybe a specialist, and they can actually get compensation for those patient care conferences as well.
Another area, and we've talked about this on the show. In fact, Dr. Brian Goldman has also talked about that, is people with chronic conditions and the elderly are often finding it hard to find physicians because they sometimes represent more work, and some physicians find it extra work. And you've put incentive in place for that. Can you explain how that's going to work?
Yeah, so recognizing that there are some patients who their care needs are complicated, their conditions are complicated. This would be health problems such as severe disabilities, sometimes mental health and substance use problems, people with cancer, where the care just is a lot more complicated. So there's a new incentive for physicians to actually say, yes, I'll provide care for a patient like that. And then there's also a complex care management fee. And the physician has some responsibilities in return for that fee, but they aren't your sort of traditional visits. There's things like making a plan, a care plan with that patient, and then monitoring that plan. And some of that work can be done by the telephone as well. Some of that work can also be done by allied professionals. And so some of the funding can go to things like hiring a registered nurse or a nurse practitioner, if that's a model that works for any given family doctor or community.
You've modeled this, as you said, after pilot projects, including one quite close to us in the Cowichan Valley, where I think they've actually gone to that sort of collaborative model. What did you see in terms of results there? Were they able to get a family physician for everyone who needed one?
Yeah, so the numbers in the Cowichan Valley is that there's 1,100 people today that have a family doctor that didn't have one in 2010. Now, I'm not sure it doesn't say that everybody has a doctor now, so I'm assuming there's still some people that are looking, but they've had some considerable success there. They've been able to recruit a new doctor. They've also established a locum program there, so that is where they've got doctors that will come and fill in temporarily if there is an illness or if somebody just wants to go on a holiday, that they've got someone that can come in and provide care for their patients, and I think that's been very successful there. They've also got a maternity clinic, I think, that started up in the Cowichan Valley where women who are expecting a baby and who don't have a family doctor, or if their family doctor doesn't do obstetrics, they now have a clinic in the Cowichan District Hospital where those women can get care.
Now, will this plan to have a family physician for everyone in BC by 2015, will it also include models like that? Because we have heard that, having a good, strong locum program, for example, allows young physicians to maybe go somewhere where there may not be, big teams of doctors to spell them off. So are you looking at expanding that?
What will happen is in different communities around the province, there's these things called divisions of family practice. So these are groups of family doctors that come together in a region and do planning together. And I think in each of these 3 pilot projects, there was a division of family practice that got together and said, what do we need to do in our community? And it was different things in the different communities. So, yeah, I think around the province, it'll be a different thing maybe in the Prince George area than it would in Trail where I used to work. But I certainly remember when I was practicing as a GP, the ability to get a locum was just huge. And when I first started practicing, it was very easy. And when I stopped practicing and became a politician, it had gotten quite difficult. So this may well be one of the areas that some of the communities really focus on.
If you search the BC College of Physicians and Surgeons website right now, it says there's only one doctor accepting new patients in Duncan. Do you feel that there may be more to be done there? I'm not sure what that says overall, but you said there's 1,100 people who found a doctor, but there's only one doctor still taking new patients.
I'm sure there's more work to be done. What happened in White Rock is they went from a situation where there wasn't anybody that was willing to take on a new patient, and there were many, many patients that were moving to that area and just couldn't find a doctor. And it has really changed. It's partly because they've recruited new people, but some of the family doctors who had closed their practice, who felt they just didn't have the capacity to take on any new patients, have been able to open their practices up. And they've been able to take on new patients, and they feel comfortable doing that. So they don't feel overworked. They've got some additional help. There's some flex in the system that wasn't there before. And as I say, it will be different in different communities as to what the need is. But I think there's just great potential here for more and more people to have access to a family doctor, and it's much better care. Unless you're always healthy and you never need to go to the doctor, it's great to have a family doctor.
No, you got that right. Thanks so much for this, Minister.
Thank you.
Bye-bye.
Bye-bye.
Margaret McDermott is BC's Health Minister. And now we're going to turn this over to you. What do you make of this plan? Is this a step in the right direction? Do you like the idea that you could check in with your physician over the phone? If you don't have a doctor, does it sound like this could make a difference? Do you want to share with us your experience of trying to find a family doctor? You can do that at 1-800-565-1446.